Torn meniscus surgery typically involves one of two types of procedures for those who have a meniscus tear. Both are done arthroscopically, meaning the surgeon uses a device which incorporates a tiny camera and a light so he or she can see inside the knee during the operation. Arthroscopic knee surgery provides a number of benefits over the type that involves a single, large incision. Smaller incisions are used to insert and control the surgical device, so there's less damage to surrounding tissue. Recovery from this type of torn meniscus surgery allows the patient to heal faster and recover sooner. A procedure commonly known as meniscus repair is one choice. The other is known as a partial meniscectomy. Meniscus repair. This procedure is designed to fix the tear itself by restoring tissue structure. Restoring this tissue is a more extensive surgical procedure, and the recovery time is longer. It also has a lower success rate than a partial meniscectomy because blood supply in meniscus tissue is generally low, so it takes longer to heal. Sometimes it doesn't heal at all, but if the procedure is a success, the knee joint tends to be healthier in the years that follow. Partial meniscectomy. On the other hand, the goal of a partial meniscectomy is to clean out torn or loose floating pieces of meniscus tissue in the knee joint. Those who have a partial meniscectomy usually report that their symptoms go away faster and they recover more quickly. Unfortunately, arthritis in the knee is more likely to develop over time when a meniscectomy is performed. Your doctor will evaluate several factors in deciding which torn meniscus surgery suits you best. These factors will include the location, size, and pattern of the tear. Your age, health, and your activity level are other considerations. In some cases, the surgeon may wait until he or she has actually inserted the arthroscope to make the final decision based on what he or she sees inside. For additional information on meniscus tears, click on the links in the description section below this video.